kidney alert is not one random bubble in the toilet. It is a repeated pattern that deserves attention before damage becomes obvious. Foam, blood, swelling, and new nighttime urination matter most when they return or arrive together. One strange day may pass, but a repeating signal deserves a urine test and blood pressure check. Early checking can protect choices before quiet damage grows. Your kidneys work quietly all day. They remove waste, balance salt and water, and help control blood pressure. They also help keep minerals and fluid in a safe range. Trouble can show up as urine changes, ankle swelling, low energy, or rising pressure. The common trap is waiting for a dramatic warning. Stones and infections can hurt, but slow filter damage may stay silent. The first warning may be a bathroom pattern you keep explaining away. Waiting for a crisis can waste time. Inside each kidney are tiny filters. They let water and waste leave through urine. They usually keep blood cells and important proteins inside. Protein means useful building material in blood. Heavy leakage can make urine look foamy for days. Foam is easy to misread. A fast stream, toilet angle, or cleaning product can create bubbles. Those bubbles usually fade quickly. Thick foam that returns most mornings is different. It can suggest protein in urine, called proteinuria, meaning the filter may be leaking. Blood is another urine warning. Red, pink, or tea-colored urine can come from infection, stones, kidney inflammation, or bleeding in the urine pathway. Kidney inflammation means the filter is irritated. The color alone cannot tell where the problem sits. Urine amount and timing also need context. Very little urine after poor fluid intake may mean dehydration. It can also mean blocked urine flow or kidney stress. Waking once after late fluids may be ordinary. Waking repeatedly for a new reason deserves review. This is where the pattern starts to matter. Severe symptoms need faster action, while returning mild changes need testing and follow-up. Foam with swelling is different from foam after one forceful stream. Blood with fever is different from red urine after beats. Those comparisons matter, but the quieter danger is easier to miss. Clear urine and lack of pain do not prove safety. Some people feel normal while pressure rises or protein leaks. Quiet kidney damage can grow before daily life changes. Blood pressure often drives that silent risk. High pressure can damage the kidney filter. A damaged filter can then make pressure harder to control. It becomes a cycle. Higher pressure hurts the filter, and a weaker filter lets pressure stay high. That cycle can run for years before anyone feels sick. A person may feel normal while home readings creep upward. A cuff that fits your arm can reveal the pattern earlier. That is why blood pressure belongs in a kidney warning discussion. This silent risk is strongest in higher risk people. Diabetes, high blood pressure, heart disease, family history, and older age raise concern. A mild sign in that setting deserves more attention. Those risks make urine and blood checks more important. Some warning signs show on the body. Swelling is often the first visible clue. Puffy eyes, tight rings, or sock marks can reflect fluid retention. Fluid retention means the body is holding extra salt and water. Swelling after one salty meal differs from swelling that returns without a clear trigger. Other warning signs feel less obvious. Fatigue can be real, but it is not specific. Poor sleep, depression, infection, thyroid disease, and anemia can all drain energy. Anemia means a low red blood cell level. Advanced kidney disease can contribute because kidneys help tell the body to make red blood cells. Broad symptoms should be treated as clues, not proof. Itching, poor appetite, nausea, or a metallic taste may appear later. A salty meal can swell ankles. A hard workout can darken urine. Repeating symptoms with urine changes or swelling deserve more attention. Medicines can also change kidney risk, especially when the body is under stress. Anti-inflammatory painkillers include ibuprofen and naproxen. Some drugs can stress kidneys during illness or low blood pressure. The special dye used in some scans and certain antibiotics can also matter. Do not stop prescribed medicine alone. When medicines are involved, Ask what needs review during sick days. Some prescriptions or pain relievers may need special caution when you are ill. Ask your clinician which medicines need review before changing anything yourself. Lab checks are the part that actually separates fear from a clear direction. A urine test can show blood or protein. Some clinics measure albumin, a small blood protein, in urine. A blood test can estimate filtration, meaning how well kidneys clear waste. Together, those checks show whether a quiet pattern needs follow-up. A blood pressure reading belongs with urine and blood tests. One urine result can mislead. Hard exercise, a urinary infection, or recent dehydration can change that result. Once those triggers settle, a morning sample may give a cleaner answer. A repeat morning sample shows whether the same finding is still there. If the finding stays, direction matters more than one result. A small urine leak may appear before obvious symptoms. One number becomes useful when your clinician compares it with past or future tests. Past labs help show whether the pattern is stable, improving, or getting worse. Pain still matters, but it points in several directions. Muscle strain is common after lifting, twisting, or sitting awkwardly. Kidney pain is often deeper and higher, near the side under the ribs. Fever, chills, vomiting, or burning urination makes that pain more concerning. Infection changes the level of urgency. Burning urination may start as a bladder problem. Fever, chills, side pain, or vomiting can suggest infection has moved higher. That kind of infection can involve the kidneys and may need urgent treatment. Blocked urine flow is another urgent pathway. A stone or enlarged prostate can trap urine and stress the kidney. Fever with side pain, confusion, vomiting, or very little urine needs urgent care. Before the clinic visit, bring useful details, not just fear. Write down when the sign started and how often it returns. Include fever, exercise, new medicine, fluid intake, and home pressure readings. Bring recent lab reports if you have them, plus a medication list or phone photo of the bottles. Photos of urine color or swelling can help when used sensibly. Those details help your clinician choose scheduled follow-up or faster testing. Persistent foam, repeated blood in urine, swelling, rising blood pressure, or more nighttime urination deserve review. You are not trying to diagnose yourself. You are helping decide what should be checked next and when. After the visit, follow-up should compare pressure readings, urine results, and blood test results. Feeling better helps, but it cannot prove the risk is lower. The next step may be repeat labs, infection testing, an imaging scan, or seeing a kidney specialist. Ask what change should trigger an earlier call. Kidneys do better with steady protection than with waiting until symptoms become severe. So take repeated foam, blood in urine, swelling, or nighttime urination seriously. Do not wait for severe symptoms to prove the problem. Kidney problems can stay quiet for a long time, so repeated signals deserve urine testing and a blood pressure check. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.